Interesting question. At what age we can start Botox? So if you look at medically, it is being approved as a drug. So when we are using for medical indications like spastic muscles or for say hyperhidrosis, age is 2 plus. But when we are looking at cosmetic indications, normally we see people in the age group of 30 plus, because by that time photo aging and all your age related changing they tend to develop. Besides that, it depends on your ethnicity, your locations. People on the higher altitudes, they develop photoaging faster. So it could be a little earlier, say 25 to 30 years. We were discussing the cost of Botox. So when we are using Botox for cosmetic indications like we are doing for the forehead lines, frown lines and crow's feet, in a female normally we need 60 to 80 units, and in a male patient depending on the severity we may need up to 80 to 100. Whereas when we are looking at a female we can use full 100 units on the face. So actually it is the amount of Botox that is being injected. We can inject lower doses as well, up to 20 units for small areas, just doing a touch up and all. So if you look at Botox, basically depending on the units, comes around 400 to 450 rupees per unit. That's the cost of the Botox. It's always preferable to get it done from a trained dermatologist or a plastic surgeon. See, whenever we are looking at pain associated with Botox injections, so it is basically what I would say is minimal, and it is a relative thing. But before botulinum toxin, what we are doing is we are applying a numbing cream. Insulin syringes are being used, which are the finest needles. It's just like a prick of an ant, and a normal individual, when we are looking at, is able to tolerate it very well. And a lot of my patients, they do even without any numbing cream. So pain is hardly a factor when we are considering botulinum toxin. So you have got your Botox injections and now you are looking at aftercare. So immediately after, if we have done on the say forehead areas, keep on using your facial muscles. A kind of facial gymnastics keep on doing, so your better dispersion happens. Normally the effect comes in 72 hours to 7 days, but if you're using your muscles immediately after the procedure for next 4 to 6 hours, it is going to dissipate faster. You're going to see early results. Secondly, if you are looking at any form of exercises, you need to avoid headstands, massages, or any form of beauty parlor service. Just avoid for 5 to 7 days post your injections as an aftercare. See, longevity of your Botox injection, so it depends on the size of the muscle. So when we are looking at upper face, if we have injected adequate doses, adequate means anywhere above 60 units, it stays for 4 to 6 months. There are certain people who go for microdosing because they want to give a natural look, then it lasts 2 to 3 months when we are injecting 20 to 30 units. Besides that, if we are looking at when we are doing for hyperhidrosis or masseter, where our dosage is increased, so definitely in these areas, it stays almost up to 6 months. Besides that, people who are exercising a lot, who have higher metabolic rates, their Botox doesn't last that much. They have to repeat it more frequently as compared to somebody who's having a low metabolism. See, when we are looking at Botox is going to work at your muscles, immediately after your injections, apply an antibiotic cream. On top of it, you can apply your light makeup. Botox can look natural, so depending on the dosage, we can inject a little lesser dose so that it looks natural, but you need to repeat a little more frequently. And washing your face gently is not an issue immediately after doing the Botox injection. See, normally nowadays, whenever we are looking for a Botox injector, the best person to get your Botox injections done is a dermatologist or a plastic surgeon. All the dermatology and plastic surgery clinics, they are doing the Botox injections, and I think they are the masters in doing that. Avoid getting it done in a spa salon, because these are the areas where people are not trained. They are not so much trained to do these procedures, and doctors are the best options, especially the dermatologist and the plastic surgeons.